Colorado is moving closer to helping people get their hands on prescription drugs that are more affordable. The state just got approved to import some medications from Canada.
It's another step in an 8-year quest to bring down drug prices. Your reporter Alan Janae is live. So Alan, the Federal Food and Drug Administration approved Colorado's plan.
They did, and along with that, the governor has been working on this for years, said, that drug makers need to stop ripping off consumers with inflated drug prices. This idea is to bring medications in from Canada, which negotiates lower drug prices on behalf of its citizens who are covered under universal health care. But even Governor Polis tempered some of what he said in the statement by noting this is just a first step. And we found out there is a long way to climb before it goes into practice. As prescriptions got filled at Capitol Heights Pharmacy, Pamela Miller talked about what she's seen as drug prices have risen.
And recently, I just was picking up a drug for $75, and I said, I don't think I need it.
Dialing back. Pharmacist and owner Kristen Holmes has seen it as well.
Your blood thinners like Eliquis or Alto, they're still extremely expensive for patients. And if they're still trying to tick away at their deductible, they might be paying $500, $600 a month for something like that.
She tries to fill what she can.
There are times when medication is so expensive that I can't support being able to just give that away.
The state's move has potential, says Tom Leahy of the Department of Healthcare Policy and Financing.
I think the challenge is the healthcare system is so complex, there really is no silver bullet. But this is one lever we believe we can pull that will help folks out here in Colorado.
But it's not just around the corner.
What we need to do is we need to partner with a drug manufacturer who is willing to have their product exported from Canada. So that's really the next step.
Drug makers sell to Canada for lower prices than they sell in the U.S. This would mean manufacturers would sell more to Canada, and drug makers have been reluctant to give Canada more.
It doesn't seem like there's a lot of motivation for me to want to do that and potentially undercut the profit that I'm making.
That's certainly a challenge. I'd say the counterpoint is, well, here's an opportunity to expand your market share in the state.
Democrat Governor Jared Polis isn't the only governor to tout this idea. It happened in Florida in 2024. It was supported there by Republican Governor Ron DeSantis as a potential answer. Florida even built a 100,000 square foot warehouse to store drugs after they're brought in from Canada for distribution out to Florida citizens. But that warehouse still sits empty. Not as of yet has it worked out for Florida. And when it comes to Colorado, we may be a smaller market, but I wouldn't count your chickens just yet. In Denver, I'm Alan Janae, covering Colorado First.
Great insight there, Alan. Thank you.